Hello. Welcome to my presentation on Medical Imaging Challenge for Automatic Invertebral Disc Localization and Segmentation from 3D Multi-modality MR3 Images. My name is Bhargav Reddy. I am pursuing M.Tech in Signal Processing and Communication Specialization from IIT TIRUPATI. In this video I describe about the challenge posted by Medical Image Computing and Computer Assisted Intervention Society in 2018 for automatic IVD localization and segmentation. Low back pain is one of the most prevalent health problems amongst population and is a leading cause of disability that affects work performances and well-being. Strong association between lower back pain and IVD degeneration has been repeatedly reported in various clinical studies. Although almost every medical imaging modality has been used to evaluate lumbar degenerative disc disease, MRI is widely recognized as the imaging technique of choice for the assessment of lumbar IVD abnormalities due to its excellent soft tissue contrast and no ionizing radiation. This, in turn, has sparked specific interest in developing methods for automated image analysis and quantification for the diagnosis of MR images of lumbar spine. The goal of MICCAI 2018 Challenge on Automatic IVD Localization and Segmentation from 3D Multi-modality MR Images is to investigate semi-automatic IVD localization and segmentation algorithms and provide a standard evaluation framework with a set of multi-modality MR images acquired with Dixon protocol. In this video we're gonna know what is IVD, causes for its degeneration and its effects on health. We're gonna know the techniques used for diagnosis of IVD degeneration. And mainly we're gonna discuss the challenge for automation of IVD localization and segmentation. What are intervertebral discs? The intervertebral discs are fibrocartilaginous cushions serving as the spine's shock-absorbing system, shortly termed as IVD. They protect the vertebrae, brain, and other structures like nerves. The discs allow vertebral motion, extension, and flexion. Why IVD degenerates? The invertebral discs may delocalize from their normal position due to abnormal postures for long durations, resulting in increased spine pressure, and may tear. Due to pressure, the soft tissue in IVD may leak. And its effects are as follows. This cause pressure on spinal nerves and affect the parts of the body corresponding to the nerves stressed. May result in pain in the spine and lower parts of the body, mainly lower back pain. How IVD degeneration or abnormality is detected? In clinical practice, spine MRI is the preferred modality in diagnosis and treatment planning of various spinal pathologies such as disc herniation, slipped vertebra, and so on. Automatic image analysis and quantification for the diagnosis of MR images of spine have drawn more and more attentions. MR images give excellent soft tissue contrast. The goal of this challenge is to investigate automatic IVD localization and segmentation algorithms and provide a standard evaluation framework with a set of multi-modality MR images acquired with Dixon protocol. What do we have to do? In this challenge, there are 7 IVDs to be localized and segmented from each image. Each team needs to submit both localization and segmentation results. Localization means identifying the location of each IVD center, and segmentation produces the binary labeling of the image into disc and non-disc regions, from which a 3D surface of the disc boundary can be extracted if needed. In brief, we need to write a program which can automatically give segmentation and localization data for each MRI image. We can develop our automation program by comparing with the segmentation and localization data given for the training data MRI images. In this challenge, there are 7 IVDs to be localized and segmented from each image. Data and evaluation. There are 24 3D multimodality MRI data sets of at least 7 IVDs of the lower spine, collected from 12 subjects in 2 different stages in a study investigating the effect of prolonged bed rest, space-flight simulation, on the lumbar intervertebral discs. Each subject at each stage was scanned with a 1.5 Tesla MRI scanner of Siemens using Dixon protocol. Thus, each 3D multimodality MRI data set contains 4 aligned high-resolution 3D volumes, in-phase, opposed phase, fat and water images. In total we will have 96 high-resolution 3D MRI volume data. For each IVD, reference manual segmentation is provided in the form of binary mask. All images, 4 volumes per patient, and binary masks, 1 binary volume per patient, are stored in the Neuroimaging Informatics Technology Initiative, NIFTI, file format. Training data consisting of 16 multimodality MRI data sets from 8 subjects and the associated reference segmentation. Here is the main thing. For the test data, the associated reference segmentation are known to challenge organizer only, thus, they will be used in the on-site for performance evaluation purpose. Each 3D multimodality MRI data set contains 4 aligned high-resolution 3D volumes. If the in-phase image can be thought of as the sum of the water and fat signals for each voxel, and if opposed phase images can be thought of as the difference between the fat and water signals, adding or subtracting the in-phase and opposed phase images results in a water-only, fat-suppressed, or fat-only, water-suppressed. What is a voxel? A voxel is a unit of graphic information that defines a point in three-dimensional space. Since a pixel, picture element, defines a point in two-dimensional space with its x and y coordinates, a third z coordinate is needed. In 3D space, each of the coordinates is defined in terms of its position, color, and density. Since MRI images give three-dimensional data, basic elementary unit of an MRI image is voxel. Segmentation is the process of identifying the voxels which belong or contain IVD volume and non-IVD volumes. Evaluation metrics. For each test image, the evaluation result would be the average value of 7 intervertebral discs. And for each metric, the final evaluation result would be the average value of all test cases. 3 metrics for evaluation are as follows. 1. Dice overlap coefficients. The dice metric measures the percentage of correctly segmented voxels. Dice is computed by formula shown in image 1. Where A is the sets of foreground voxels in the ground truth data and B is the corresponding sets of foreground voxels in the segmentation result, respectively. Larger dice metric means better segmentation accuracy. 2. Average absolute distance. Average absolute distance, ASD, is a metric measures the average absolute distance from the ground truth disk surface and the segmented surface. Smaller average absolute distance means better segmentation accuracy. 3. Localization distance. The equation of localization distance R is computed as shown in image 2. Where x is the absolute difference between x-axis of the identified IVD center and the ground truth IVD center calculated from the ground truth segmentation, y is the absolute difference between y-axis of the identified IVD center and the ground truth IVD center, and z is the absolute difference between z-axis of the identified IVD center and the ground truth IVD center. Smaller localization distance means better segmentation accuracy. In short, evaluation or grading of our program written for automation is based on how accurately our program is generating IVD localization data and how precise is our segmentation on test data after we submit out program to organizers. For full details visit website https://ividm3seg.weebly.com. Thank you for watching this video. This video is made as an assignment work for medical imaging course at IIT TIRUPATI.